I went back to general practice, and I was seeing patients in practice who were in the same boat that I'd been in, different backgrounds, sometimes different stories, but same kind of issues. And I found myself reaching for the prescription pad, or referring to services which would then reach for the prescription pad, and not able to refer them. There was no history in the area I was working in referring anyone to residential rehab. There was no budget for it. There was no interest in it. There were no pathways to it. I couldn't offer people the same treatment I'd been offered as a middle-class doctor. And that is really uncomfortable, because lots of people come to see their GP with alcohol or other drug problems. And that's when I thought I need to do something about this. So the germ of the idea was saying, well, first of all, I need to teach myself properly about addiction and recovery. And I went back to university and did a master's degree and then in alcohol and drug studies. And then I thought I need to then work in a rehab setting to understand the medical aspects of rehab, and how to do it safely, and what we need to consider when it comes to detox and mental health and physical health care and so on. And I did that. I got a job in a rehab, and was there for 9 months, and learned a lot about how to how medicine worked in a rehab setting. And then I started to work in communities settings and community clinics, mostly ironically, but which I'm fine with, which was harm reduction interventions, medication-assisted treatments, helping people often in really difficult situations stabilize, try to keep them safe, get their blood-borne viruses checked, get them titrated onto opiate replacement if opiates were the problem. Connecting them up to support systems as best I could. And that was really good grounding. But again, working in those community clinics, we had very limited access to residential rehab, and it wasn't an established thing to do. It was, it was a really unusual thing to suggest, although we did get some people to rehab.